the need to marry innovation and affordability, right? In terms of a lot of the new cell and gene therapies that are coming to market, and the challenge that wasn't able to be fixed with the Inflation Reduction Act, which is tackling the launch prices of new medication. So that is something we're thinking about, and also thinking about what are the what can we, it shouldn't be, the discussion shouldn't be about how can we pay, it should be how we lower the price, and what are the mechanisms we can do to ensure that all the people who need access are able to get it. Because we saw with the sickle cell drug just a couple of weeks ago that the first patient, a young 12-year-old boy here in actually Washington, D.C., was able to get the first treatment for the disease. But we also know that with the price tag of 7 figures, states would be bankrupted, and especially given this unique population that is primarily Black or Latino folks in this country, a majority of whom are also on Medicaid. So we're thinking through that, and then thinking about, you know, we are aware that, like in Spain right now, they are looking at, say, like CAR-T therapies, and they have been able to produce them at about a third of the price of what you're seeing here in the United States. And then Brazil, for example, is already starting to focus on an alternative model as well, where it's not through a bottleneck through a pharmaceutical corporation, which in this case with CAR-T patients, you're seeing actually 25% of patients dying waiting for their cells to be returned to them, which is just totally unacceptable. And there are these alternative models that I think we should be thinking about, which will still allow, of course, the pharmaceutical corporations to make money, but at a level that is more affordable for people. If you imagine the centrifuges that are needed, it's pretty simple. Right now, rather than those being housed in hospitals or centers of excellence, there are some, but they are centralized. What I'm talking about is like a decentralized model, where potentially the patient, much closer to the patient, so that there's not a lag time in the sending of these cells and then their return to the patient. And we've seen from folks like Caring Cross, who are actually here in Maryland, that as a result, they're able to lower the price significantly. And it just means that the turnaround for patients is much quicker